Hello, I'm Kathy Johnson, President of Centerra Northern Virginia Medical Center. It's my pleasure to be with you today to present this virtual introduction to mission, vision, and values at Centerra Northern Virginia Medical Center. I have been with Centerra since June of 2016. I came from North Carolina, even though I am originally from New York. You will find, as I did, I'm sure, that the team here is very committed to our patients and to each other, and they're an absolute pleasure to work with. So welcome to Centerra, and I hope you enjoy our presentation today. At Centerra, our mission is to improve health every day. Our values include people, quality, patient safety, service, and integrity. Our vision is to be the healthcare choice of the communities we serve. This couldn't be more true than here in the Northern Virginia market as we continue to grow our programs and services to meet the needs of our community right here close to home. At Centerra Healthcare, our strategic initiatives are focused on clinical quality and safety, customer centricity, which is putting the patient at the center of everything we do, and growth and innovation. Every member of the team agrees to uphold our commitments to our patients and to one another every day. Our commitments are always keep you safe, always treat you with dignity, respect, and compassion, always listen and respond to you, always keep you informed and involved, and always work together as a team to provide you quality health care. Centerra Healthcare has a 130-year not-for-profit mission. Currently, Centerra has 28,000 employees at 300 sites of care across the health system. The health system is comprised of 12 hospitals with 2,734 beds, 3,696 physicians, and 1,263 advanced practice practitioners. Other statistics regarding Centerra are up on the screen for your review. What you can take away is that Centerra Healthcare is a very large system and that Centerra enjoys a very strong financial position. Centerra Healthcare originated in the Hampton Roads market and maintains a dominant presence throughout southeastern Virginia. Centerra Northern Virginia Medical Center was the first out-of-market acquisition for Centerra Healthcare as they began their focus on growth. Following our merger, the hospitals in the Blue Ridge region, including Centerra Rockingham Memorial Hospital in Harrisonburg and Centerra Martha Jefferson Hospital in Charlottesville, also merged with Centerra. Halifax Hospital in South Boston, Virginia, and Albemarle Hospital in Elizabeth City, North Carolina, are also part of Centerra Healthcare. Centerra Northern Virginia Medical Center is proud to be among leading hospitals in the Commonwealth of Virginia and to be part of a nationally ranked top healthcare system.
Hi, I'm Dr. Jeffrey Moore, Medical Oncologist and Breast Program Director for the Centerra Northern Virginia Medical Center Breast Program Leadership Committee. I would like to introduce our 2022 committee members: Heather Casso, Dr. Amanda Bauer, Dr. Farn Chan, Dr. Clarissa Hammer, Dr. Robert Cohen, Dr. Bryce Johnson, Dr. Claudine Morcos, Heather Byrne, Melissa Botello, Dina Henry, Wendy Atkinson, Dawn Byrne, Helen Linton, and Tammy Jackson.
Hello, my name is Christy Grabus. I am the Chief Nursing Officer here at Centerra Northern Virginia Medical Center, and I'm going to guide you through the next several slides. We are proud to be a part of the Centerra Cancer Network, a designation we earned through the development of a broad scope of services for patients diagnosed with cancer. Our program includes a team of specialists and subspecialists, a full scope of clinical services, and the robust support services provided through our Cancer Resource Center. Through our cancer program, we offer focused services for women's breast health, including our beautiful mobile mammography unit, funded by the Potomac Health Foundation, which supports awareness and outreach to provide annual breast screenings. All of our sites for our mammography offer 3D mammography, also known as tomosynthesis. We are proud of the many accomplishments in our cancer program, including numerous awards and accreditations, the launch of the cardio-oncology program, the introduction of PET-CT services at the Century Medical Building, a streamlined direct admission inpatient chemotherapy process, and our Centerra Cancer Network Resource Center. Our beautiful center is also located in the Century Medical Building as we bring these services together for the convenience of the patient. Specialty-trained oncology nurse navigators support patients from diagnosis through treatments to survivorship, connecting patients to providers and providing services and support.
I'm Melissa Botello, Manager of Imaging and Transportation Services at Centerra Northern Virginia Medical Center. Centerra Northern Virginia Comprehensive Breast Center has state-of-the-art imaging, including mammography, ultrasound, biopsy, and MRI. We are excited to announce that outpatient imaging will be relocating to the Century Building in 2022 as part of our strategy to co-locate outpatient cancer-related services in one building.
Hello, my name is Heather Byrne. I'm an oncology nurse navigator at Centerra. The Century Medical Building is a hub for outpatient cancer services. In the Century Building, we have radiation oncology, 2 medical oncology groups, mobile PET-CT imaging, outpatient rehab, breast surgery with Centerra surgery specialists, a Centerra Medical Group primary care practice, the Centerra Cancer Network Resource Center, and coming soon, outpatient imaging services.
The Centerra Cancer Network Resource Center is a place that's built around the patient's needs, particularly the patient and their loved ones who are going through a cancer diagnosis and treatment. It's a place for them to come to receive education and support, and sometimes just to rest between appointments in a quiet atmosphere that doesn't look like a doctor's office.
The Centerra Cancer Network Resource Center is a hub of activity. We have yoga classes for patients in active treatment for their cancer. We have support groups that meet there. We have conferences there. We have access to supplies and equipment that might be needed specifically by our cancer patients. We have computers and fax machine for people to access as they're trying to navigate some of the paperwork that's necessary.
The Centerra Cancer Resource Center was built through funds from a grant from the Potomac Health Foundation.
There is no cost for any of these services. Consulting with a navigator, attending classes, using the computer and the fax, those are all part of the service that Centerra offers. As people go through this experience, there's enough on their plate already. And you need someone to help you get through those steps. That's what we do.
We like to think of our center as a safe haven for them to come between appointments, to seek support, education, and just somewhere to rest their weary bones for a little while.
Centerra Cancer Network Resource Center is a little slice of heaven for me and for our patients.
Hello, I'm Val Keene, the Vice President of Operations, and I'm proud to be part of the hospital for more than 33 years. At our outpatient therapy centers, patients are provided a variety of therapy services to augment healing and wellness, including chiropractic and alternative therapies. Locations include the Century Medical Building, Reed's Prospect at County Center, and Stafford, with a new office location coming soon to Dumfries.
My name is Deborah Talbot. I'm a nurse at the Centerra Northern Virginia Medical Center Outpatient Infusion Center, and I've been working in there for about 12 years now. The first thing before a patient can have an appointment is we need an order from the doctor. It's actually quite simple. We just get the order and we'll contact the patient about a time and a date for them that works. The services that we cover in the infusion center are varied. We give all kinds of treatments. Chemotherapy, of course, is one of our big #1 treatments that we give. Once we have the patient scheduled, the process for the infusion treatment, they will come to the hospital and go to registration, where they'll sign their papers and they'll get armbanded. And then the registration staff will take them to a waiting area and they will notify us that the patient is there. We will go and pick them up from the waiting area and bring them into the infusion center. And then we will contact pharmacy and let them know that they've arrived, and pharmacy will start preparing their medication. And then once their medication arrives, then we will give them their treatment.
In January 2016, we opened a new state-of-the-art facility offering full-scope surgical services, including Da Vinci robotics and specialty navigation for orthopedics and neurosurgery. We are supported by a complement of surgical specialists, including neurosurgery, and offer specialty procedures, including aquablation therapy for BPH and links for GERD.
Centerra Northern Virginia Medical Center is part of Centerra Cancer Network, which is accredited through Commission on Cancer as an integrated network cancer program, first system in Virginia to achieve this accreditation. We are a fully integrated network of hospitals throughout Hampton Roads, Blue Ridge, and Northern Virginia. We have monthly system oncology service line meetings and quarterly breast program meetings, in addition to our quarterly on-site breast program leadership meetings. Locally, we have 2 cancer conferences per month. We had a number of accomplishments since our last NAPBC accreditation. Opening of the Centerra Cancer Network Resource Center, recruitment of an additional oncology nurse navigator, Centerra Medical Group telegenetics services was implemented for breast cancer patients in 2020 and expanded to all cancer patients in 2021. Peer mentor program was established in 2020. No oncology-related CLABSIs for 2020 and 2021. Development of an immunotherapy card and protocol for the ED. Potomac Radiation Oncology Center achieved accreditation program for excellence from the American Society of Radiation Oncology. And mobile PET-CT opened in June 2021.
Although things were put on pause during COVID, at Centerra, we take pride in being engaged with our community, providing outreach, health screenings, participating in community events, sponsorship of the Potomac Mill Milers Club, and raising health awareness. We engage in many different partnerships to enhance the overall health and wellness of our community.
Hi, I'm Heather Cassot. I'm the Oncology Service Line Director at Centerra Northern Virginia Medical Center. Looking ahead, we are looking at significant enhancements to our breast program to include recruitment of an additional breast surgeon, breast radiologist, and plastic and reconstructive surgeon, exploring opportunities to expand our telegenetic services, increase our PET-CT availability, and relocation of our outpatient imaging services to the Century Building, our hub for outpatient cancer services. Thank you for taking time today to learn about Centerra Northern Virginia Medical Center's breast program. We welcome you and we hope you enjoy your time during the survey.